Do you or one of your loved ones suffer from the challenges of diabetes? Managing blood sugar can be a constant struggle, but what if we told you there's a revolutionary solution? Wearable technologies for diabetes management. Hey there, I'm Insuleni, and you guessed it, I'm insulin. Today, I'll be your guide through the world of diabetes management with wearable technologies. But before we begin, let's quickly learn more about diabetes. Diabetes is a chronic health condition that affects your blood sugar levels. Our bodies naturally produce a hormone called insulin, which helps to control the flow of sugar into our cells so that it can be used as a source of energy. In patients with diabetes, there is a lack of insulin production, leading to low energy levels. There are two types of diabetes. In type 1, the pancreas does not produce insulin at all. In type 2, the pancreas produces less insulin than normal. Today, there are over 5.7 million Canadians living with diabetes. There are many ways for people to manage their diabetes. In fact, technological advances have made it easier for individuals to monitor their blood sugar and need for insulin. Specifically, there are two wearable technologies that individuals commonly use: continuous glucose monitors, also known as CGMs, and insulin pumps. Having a continuous glucose monitor is like having a watchful friend. CGMs keep an eye on your blood sugar all day and all night. CGMs have a sensor that is applied under the skin, typically on the stomach or arm with an applicator. The sensor measures blood sugar levels in the fluid under the skin. Once the sensor is applied, an adhesive bandage is used to help hold the sensor in place. Every few minutes, blood sugar information is sent to a transmitter, which is often attached to the sensor, and a receiver, which is like a cell phone, or to an app on your phone. It is up to the user to take the information from their continuous glucose monitor and act accordingly. For instance, if the information tells you that you have low blood sugar, you can use glucose gel to raise your blood sugar up. If the information tells you that you have high blood sugar, you could take an appropriate dose of insulin. Depending on the device, CGMs need to be changed every 7 to 14 days. Insulin pumps, on the other hand, are like personal chefs. They deliver the body with fast-acting insulin throughout the day. Insulin pumps take away the hassle of injections, making diabetes more manageable. Like a private chef, an insulin pump offers customized, precise, and convenient care through its insulin delivery system. There are 3 parts to insulin pumps. The pump, which includes a battery and controls, pumps insulin into the body. The reservoir holds the insulin. And an infusion set, where a thin tube called the cannula connects the reservoir that has been placed inside the pump to the infusion site, which is under your skin. An adhesive bandage is used to hold the cannula in place. There are 2 types of insulin doses delivered by insulin pumps: basal insulin doses, which are delivered continuously. This maintains blood sugar between meals and overnight. And bolus insulin doses, which are delivered by pressing a button on the pump. After a meal, this button is pressed and insulin is released to the correct high blood sugar. Insulin pumps can be placed anywhere on the body, but are commonly located on the stomach. Now, it should be noted that CGM can be paired with an insulin pump. This is called an integrated CGM. A software system is used so that the insulin pump delivers the correct dosage of insulin based off of information from the CGM. Now, let's talk about some benefits of wearable technology for diabetes. One such example is that it helps control blood sugar levels more easily. Specifically, keeping your blood sugar levels in check by reducing the risks of highs and lows so you feel better every day. Wearables also reduce the hassle of diabetes treatment, as now you can say goodbye to frequent injections and finger pricks. Wearables streamline your diabetes care, making it more convenient. Wearables also provide real-time data, like a personal diabetes coach, helping you make timely decisions to manage your health. Finally, wearables also provide you with better control over your condition, so you can live a fuller life, enjoy your favorite activities, and eat the foods you love, all with confidence. Although full of benefits, wearables do have some disadvantages, as they can be expensive, but if your insurance covers it, you're in luck. Also, in rare cases, the insertion of these wearables may cause infection. Therefore, proper sterilization is always important. In our journey to better diabetes management, let's focus on the critical role of support from loved ones. Here are some key ways you can make a difference. 1. Be mindful of their needs. Understand that managing diabetes can be challenging. Be patient and empathetic when they face difficulties. Be a good listener and a source of emotional support. Just being there can make a huge difference. 2. Learn together. Educate yourself about their devices and how they work. This shows that you are interested and willing to be a part of their diabetes journey. Learning together not only enhances your knowledge, but also strengthens your bond. 3. Assist with technology. Familiarize yourself with how to use these technologies so you can step up when needed. Your support can save the day. Remember, your support can make a world of a difference. With your help and encouragement, they'll feel more empowered to embrace these technologies and manage their diabetes effectively. Thanks for watching. If you want to start using wearable devices to manage your diabetes or want more information, please consult your healthcare provider. This is Insuleni, signing out.